This month, in the heart of Nairobi's Eastlands, Farah Foundation has teamed up with Comarock Modern Hospital to bring accessible health screenings and wellness education to the communities of Comarock, Kayole, and nearby areas. We hope to trigger the identification of any health problems by coming to the community and connecting people with any further health services they need to follow up. Over the course of a month, this community medical camp will reach around 900 people, offering free health screenings, diabetes awareness talks, and general wellness checks. We are bringing healthcare to the people of this area and ensuring it is accessible by setting up in common community areas. Our pilot session on the 6th and 7th of November took place at the local bank, followed by health camps in local churches and mosques.
Currently in Nairobi, we are operating out of the Eastlands area where we have a very big school with 1,700 learners. In terms of what we are doing this month, November being the month where we recognize non-communicable diseases and specifically diabetes and hypertension, we are really trying to engage the community with that in mind to create awareness. In general, Africa has really concentrated on communicable diseases. That's basically things like tuberculosis and malaria and others. And therefore, to some extent, there's been a neglect on what is now emerging as non-communicable diseases, the most common ones being hypertension and diabetes. For us, we've seen this experience across the 4 countries that we operate in, Kenya, Rwanda, Somaliland and Ethiopia, and we have really seen that there's a significant impact in terms of economically and also on the health of the people by non-communicable diseases. Not only is there impact, but it's also growing. That's what's really alarming. And here in Kenya, we know it's the same situation, and therefore with the community and other stakeholders, we are trying to ensure that we create awareness. The beauty about those 2 conditions is that they are preventable. So every year we'll be running similar programs, ensuring that awareness is created. In spite of the fact that throughout the year we'll still have that, but we'll really use November as a spotlight. Now, in terms of how it links to our overall vision and mission, we feel that a healthy society is able to contribute productively to the welfare of their families and the community in general.
Farah Foundation, in partnership with Comarock Modern Hospital, has set up this fully sponsored initiative. Farah Foundation has provided the equipment and medical supplies, whilst medical professionals from Comarock Modern Hospital are here to provide health assessments, consultations, and immediate emergency services. We hope that for those patients who need it, this event is not a one-off, but a trigger to seek out the right help and look after their health long-term, knowing where to turn to for in-hospital care.
Today, in collaboration with Farah Foundation, we're trying to create health awareness during this diabetes month, the month of November. So typically what you're doing today, we screen people for their random blood sugars. We're also doing firstly the BP checkup and any other illness they probably have. What you're trying to do today is try to have an outreach towards people within our community, those who can afford and those who cannot afford. Today we're in partnership with all our friends and our neighbors in the community at large.
So by screening, we are able to identify people who have chronic illnesses that they have not gone to the hospital and advise them on the way forward, at least to get medication.
With this, we are trying to get back to the society, to tell them there's need for checkup every day, so that those diseases that they didn't know, they can be identified early and be treated early before it goes to a chronic state.
It's good to know your health. Sometimes you always ignore waking up in the morning, feeling a little bit of something in the body, then not attending to it. It may trigger something, I was not expecting it, but today they've come here at our church. I wasn't even planning to check my status, but because it has just come to our door, I had to, and it's very nice, very convenient.
I didn't have to travel so far as I was just coming to church today, and I got a lot of questions answered. I think I'm now ready to take a step on my health.
It's nice knowing your health and health status, how you're faring, and all that, and everything is great.
At least I know my pressure, my height, my kilos. It was okay. And the doctors are very sweet. It was nice. It was very nice.